Hello everyone, this is Dr. Prashanth and welcome back to my public health series. In this video, I'll be talking about the recent UGC-NET paper where I'm not going to solve everything, but I'll try to share some tips and strategies to get more marks in each section of the paper. So let's start with paper 1. So before solving paper 1, always keep in your mind your strengths and weakness. As I already told in my first video, you should respect your strengths and also your weakness. So I'll share my approach how I would have solved these questions in the exam. So basically, a data interpretation or any basic numerical questions are my strengths. So what I will do in the exam, if my first question is DI, I will solve it. I'll spend some decent time on that because I'm sure that I can get 5 out of 5 in this section. But if DI is not your strength, I suggest you to don't read anything. Instead, just scroll down till you find a theoretical question. You already know, right? As you have been through all the previous papers, it's around 5 questions from DI. So just skip to the sixth question, which can be a theoretical question. Okay. But as I already said, in this video, I will tell my approach how I would have solved these questions in the exam. So as I already said, DI is my strength. I'll start with DI, but I'm not going to solve all the DI questions because I think it will take a lot of time. So instead, I will solve two questions for demo so that at least someone who is trying to solve DI questions will get an insight. So basically, this is the table or the comprehension where they have given the town-wise details of channel viewers for different towns A, B, C, D, E, and they have given the percentage of channel viewers for each town along with number of viewers who got subscribed to the channel. So this was the table given in the question, and they have given a hint that there are total 1200 viewers for the channel in the town E. So that means because we know the percentage of viewers in each town, right? So if you know the total viewers in specific town, you can calculate the total number of viewers in all the towns. So for example, the total viewers are equal to X, then the viewers in town E will be 20% of X because that was given in the question directly. So if you solve this, you will get X equal to 6000. X is nothing but the total number of viewers, including all the towns. Okay. Once you know the total viewers, you can just calculate the viewers per each town by just multiplying the percentage with the total number of viewers. That is 6000 multiplied by 12% in case of town A and 15% multiplied by 6000 in case of town B, and similarly for town C and town D. So you got the total viewers per each town also now. So you know the subscribed viewers also. So now you can calculate unsubscribed by just subtracting the subscribed viewers from the total viewers per each town. So that is 720 minus 440, 900 minus 500, 1680 minus 880, 1500 minus 700, and 1200 minus 360. So after doing this, you got a table where you know the subscribed and also the unsubscribed. So let's start with the first question where they're asking. So if you have not watched my first video of DI, please watch it because I have given an approach in that video how to convert statements into equations and solve the questions. Okay, you can find that in my playlist. So basically in the first question they are saying if the number of male unsubscribed viewers in town D is 200 by 3% more than that of female unsubscribed viewers in the town D. So what does it mean? You can see from question the first statement could be male unsubscribed is equal to female unsubscribed plus 200 by 3% of female unsubscribed because that was given directly in the first statement. So now they are asking you to calculate the what is the ratio of number of male unsubscribed viewers in town D to the number of unsubscribed viewers in town A plus town C together. So what will be the question in terms of equation? It is male unsubscribed in town D divided by total unsubscribed in town A plus total unsubscribed in town C. So this is something which you're supposed to calculate. So in terms of, if you just convert this statement furthermore, it will become male unsubscribed in town D divided by, so what is the total unsubscribed in town A? It is 280, right? Because it was given in the table, which we have calculated indirectly, right? So 280 plus 800 is the total unsubscribed in the town C. So now coming to the solution, from first equation, that is M unsubscribed is equal to F plus 200 by 300 of F, right? Because it has become 300 because we have converted the percentage into numbers. So if you calculate this, you will get an equation M is equal to 5F by 3, or in terms of F, it will be 3M by 5. Now, unsubscribed viewers in town D, that is both male and female, is equal to 800. That we can know directly from the table. Okay, go to the D column, town D, and see the unsubscribed, that is total 800. So M plus F is equal to 800 and M equal to 5F by 3 or F equal to 3M by 5. Now you can solve this equation very easily. So if you solve this equation in terms of male unsubscribed, because they're asking you to calculate in the numerator male unsubscribed in town D. So we will find this answer in terms of male unsubscribed, that is M. So if you solve, M will be equal to 500. M plus F is 800, so F will be 800 minus 500. So now coming to the calculation part, I mean the final calculation, in the numerator, M should be 500 divided by denominator. We already know directly from the table, right? Total unsubscribed in town A and town C, that is 1080. So if you calculate, the answer is 25 by 54. I hope it's very clear. Now coming to the second question, it also follows the same approach. You need to convert the statements into equation. So what will be the first statement? If out of number of viewers from town C, 325 by 7% are female and 7 by 13 of the number of female viewers are unsubscribed viewers. So this is something they have given in the question. Let's try to convert this into equation. So first statement, that will be total viewers in town C is equal to 1680, because we know it directly from the table, right? So they are saying out of total viewers, that is out of 1680, 325 by 7% are female. So what will be the female F total? That is equal to 325 by 7% of 1680. It's clear, right? And out of this total female, 7 by 13 are the viewers who are unsubscribed. So to get unsubscribed female, we get 7 by 13 of total female. Very simple. So now they are asking you to calculate the number of unsubscribed male viewers from town C. So different in the same town, they are asking you to calculate the male unsubscribed. So what will be the male unsubscribed? So before that, we need to calculate the total unsubscribed in town C. So what is the total unsubscribed in town C? We get it directly from the table, right? So it is around 800. So M plus F unsubscribed is equal to 800. And now the equation will become male unsubscribed plus female unsubscribed is equal to 800. So female unsubscribed will be equal to 7 by 13 of female total, because which we have got from the second equation. So if you solve this, that is 7 by 13 of what is F total? 325 by 7% of 1680. Very simple, right? So total female unsubscribed will be 420. So M plus F is equal to 800. F equal to 420. So what will be the value for male unsubscribed now? M is equal to 800 minus 420. So the answer is 380. So similarly, you can calculate the other questions also. One most important thing in solving data interpretation is you need to make a table where you get all the indirect values in the table. Okay. So after that, you can solve any question by applying simple logic. So as I already said, this is my strength. I can get 5 out of 5 in this question, right? So then I can skip to the next question. So as I already said in the beginning of the video, you should not spend much time on any question, okay? If you are not comfortable or if you are not okay with that question, please skip it immediately at the first go, okay? You can look at these questions at the end of the exam again. So let's come to the sixth question. This is regarding fallacies, informal and formal, because I don't want to waste my time now. I'll look at this question in the end of the exam. So now coming to seventh question, same, I'm not going to answer this. Now I came to eighth question, which is something I can approach this question because it is related to computer, right? So dash that monitors and records what you type on computer or mobile phone. I know third option is virus, which is not the perfect option for this question. And Trojan horse is also a virus. So I'm not going to pick any option that is between 3 and 4. So what I will do, I'll put something option, between 1 and 2 for time being, okay? And I will keep in my mind, I need to review this question at the end of the exam. Okay, now coming to question number 9, I am not going to answer this at first attempt. Now coming to question number 10, which is very direct. So which of the sampling is likely to have least bias? Any sampling, that is randomization, okay? Because all the other types of sampling or convenience or purpose, where you are taking sample on basis of your convenience or purpose. And snowball technique is also similar to that. So basically simple random sampling is something you are picking samples randomly. So which will minimize your bias. So I can solve this question very directly. Now coming to question number 11, plagiarism. I'm not going to answer this question now because the options are very close. So which I will look at the end of the exam. Now coming to question number 12, it is I think a very direct question from the water purification. I'll just show my notes also for this. Okay, this is the steps involved in water purification by rapid sand filters. Just see flocculation, sedimentation, and filtration. So flocculation should be followed by filtration. Okay. So I think this is very direct question. You can just answer it if you have been through my material or videos in my playlist. So I can answer this question at first attempt. Okay. Question number 13, I am not going to answer this now. Question number 14, I will skip it now. Question number 15, I'll skip it. And coming to question number 16, very easy. I think SMS, that is short message software, is not the correct full form of SMS. Okay. Now coming to the next question, this I can answer at the first attempt, okay, because I know the full form of CPU, very easy, Central Processing Unit. So third blank should be CPU because it carries out processing and turns data into information. And RAM and ROM are something related to memory, right? Whereas motherboard is something different. So I think the question is very clear to answer this very easily. Now coming to next question, question number 18. This is very easy question because if you see the options, for example, for option A, they have given four different options for A, right? 1, 2, 3, 4. So you just need to solve only one question in this. That is average of squares of first 10 natural numbers or average of first 5 multiples of 5. So what I will do, this is very easy, right? Option B, to calculate the average of first 5 multiples of 5. What does it mean? 5 plus 10 plus 15 plus 20 plus 25 divided by 5. So very direct question. I am not going to miss this question. So I can do this at first attempt. Now coming to question number 19, skip it because I don't want to look at these questions now. Question number 20 is something very easy because whenever you see these terms, internet, intranet, I think very easy, right? So this I can answer very directly. So I think if you can see option D, they have given different options for option D, which is internet. So that is very easy. So you need to look what is internet. It describes today's worldwide connections of networks. So very easy, right? So now coming to question number 21, I will skip this. Now coming to question number 22, this I can attempt because this is a very generalized question. Which of the following aspects do not pertain to deliberate practice of learners? The task is too easy or too hard. The learner is given informative feedback about his or her performance. This is very clear. The learner has adequate chances to repeat the task. That is also good. The learner has the opportunity to correct his or her errors. That is also fine. But when it comes to the first option, that is the task is too easy or too hard, I think it won't fit in this frame. So it is also very direct. Question number 23 related to education policy. This I will look at the end of the exam. Now coming to question number 24, which is also very direct question. I think this is related to MDGs and SDGs, right? So I'll just go to that page. Okay, you can directly see the goals and have given a different, I mean, a better picture for this. Even if you have watched my video in my playlist, you can answer this question very directly. So this I can answer. And now coming to question number 25, I will skip this for time being. Question number 26, again a numerical question, and this is my strength. I know that I can get this answer very correctly. I'll roughly show the solution for this very quickly. I think this is for question number 26. Let me read the question. There are some cows and ducks in the park, and the total number of heads of cows and ducks together is 60. So what does it mean? It means C plus D. I mean cows plus ducks is equal to 60 because both of them has only one head, right? So whenever they say head, it is equal to one cow and one duck. So C plus D is equal to 60. And similarly, next step is, however, the total number of legs of the cows and ducks together is 180. So you know how many legs a cow has and how many legs a duck has, right? So simply you just need to put 4 legs for cow, that will become 4C, plus 2 legs for duck, that will be 2D, is equal to 180. So if you solve this equation, mathematical equation, you will get C is equal to 30. So ducks and C together is 60. So C will also become 30 and D will also become 30. So the answer is 30 and 30. Okay, I think this is very easy question for me. Now coming to question number 27, this I can answer very easily because they're asking you about the operating system. We know that Microsoft Word and Microsoft PowerPoint, which we use on daily basis, are not part of operating system, and also the Photoshop. So it should be, answer should be Linux and Android, right? So it's very easy. The option is B and E. Now coming to question number 28, which is also a numerical question. Basically, it's a number series question. I will quickly show you the solution. So the question given as 4, 10, 20, 34, 52, 74, and what will be the next number. So first we need to look at the difference between these numbers. So the difference has 6, 10, 14, 18, 22 and 26. Now you need to look at the difference between these numbers, these differences, okay? 10 minus 6, 14 minus 10, 18 minus 14, 22 minus 18, 26 minus 22. So in all the cases, the difference is 4. So we need to add 4 to 26, right? Sorry, 4 to 22. So the next number will be 26. So 74 plus 26 will be equal to 100. So it is a very easy question which I can answer in the examination. Now coming to Next question 29, I'll skip it. I don't waste time on these questions because again 30 I will look at this at the end of the exam. Now coming to 31, this is also a previous year question, but I'm not going to answer this now. I'll skip this question. Now coming to the next question, which is also a numerical question, which I can answer this question. So basically the question is, if a fraction, for example, I'm taking that fraction as x by y, is multiplied by itself, that is x by y multiplied by x by y, and then divided by the reciprocal of the same fraction, that is y by x. So what will be the equation for this? X by y multiplied by x by y divided by y by x is equal to 49 8 by 27. So if you solve it, x cube by y cube is equal to 1331 by 27. So x by y will be cube root of 1331 by 27. So the answer is 11 by 3. So which is very easy for me. So I will answer this question at the first attempt. Now coming to question number 33, I will skip this for time being. Coming to question number 34, I will skip this. Now coming to question number 35, which is also a numerical question. This I can solve it at the first attempt. So this is very easy question, but if you look at this, you might feel it very complicated, but it's a very easy question. I'll just show you the binomial distribution formula now. Okay, this is from my material. I have given the formula and an explanation of each term also. So basically, they are asking you to calculate the variance of binomial distribution. Very simple. The formula is NPQ. So if you calculate NPQ, you don't need to calculate for all the options because they have given different options for option A. Because A1, A2, A3 and A4, right? You just need to calculate for A. What will be NPQ? 7, that is N, multiplied by P, that is 0.3, multiplied by Q, that is nothing but 1 minus 0.3, that is 0.7. So 0.7 into 0.3 into 0.7. So the answer will be 1.47. So if you can solve only one option, you don't need to look at the other options, right? So this is something I can solve and I know this answer will be correct. Now coming to question number 36, I will skip it for time being. Again question number 37, I will skip it, and 38 also I will skip it. And coming to 39, which is very direct question, which of the following is known as heart of sewage treatment, that is secondary treatment. Okay, a very straightforward question. Now coming to question number 40, which is very easy, you can answer it very easily. Option D, internet is something interactivity. Hot medium which carry high intensity of information. Print is something asynchronous. Radio which works only on acoustic medium. Okay. Now coming to question number 41, I will skip it. Question number 42, I will skip it for time being. Question number 43, which is very easy, and I'll just tell a very shortcut for this. Okay. So they have given Kashmiri cuisines are good is coded as KICIFNGI, right? You like Kashmiri cuisines is coded as AILIKNCI. So one simple technique to solve these questions without solving the entire puzzle is first see what is Kashmiri and cuisine. To know the code of Kashmiri and cuisine, you need to look at the first two statements. So when you look at the codes of first two statements, it is KICIFINGI, AILIKI and CI. So you see two codes common, right? I mean two alphabets common, that is KICI. So that means Kashmiri can be KI or CI and cuisine can be CI or KI. It can be anything, but you know that KI and CI belongs to Kashmiri and cuisines. So in the options, I mean in the question they are asking how the words you Indians and best are coded in this language. So in the options, you should not find anything related to Kashmiri or cuisine, right? So that is KI and CI. Any option that has KI and CI is wrong in this case. So look at the first option, they have given KI, so it's not the correct answer. Second option, they have given KI and CI, that is also wrong. Third option, if you see AI, MI and TI, okay, this can be correct. What is fourth option? AI, MI and again they have given CI. So fourth option is also wrong. So the only option that is correct is option 3. So this is the easy way to answer these questions without solving the entire codes. Okay. Now coming to question number 44, I am not going to answer this now. Next question number 45, again I look it at the end of the exam. Now coming to next question, that is comprehension from question number 46 to 50, a total of 5 questions, and we all know that we can score 5 out of 5 in comprehension if we do not overlook the question. So by using this approach, the total number of questions I got correct in the first attempt is 28. So that means there are still 22 questions which I can solve them at the end of the exam. So by using this approach, you can save a lot of time and also you get a lot of time to solve the paper 2 also, which is very important, right? So this is something which I was supposed to tell you. And now don't follow this approach very blindly, because this approach is for me, because I personally respect my strengths and weakness. If you can see all the questions which I have skipped, they're mostly theoretical questions, right? So if you're okay with answering those questions, and if you're having difficulties with the numerical part, your approach should be something different or quite opposite to this approach, right? So please keep this in your mind. I hope this is helpful for paper 1. So now let's go with the paper 2. Now let's start with question number 51, which is related to public health emergency. It is a direct question, and the correct options are: it has to spread internationally, and the event should be unusual or unexpected. So very easy question. Question number 52 is also a direct question. Dash is dietary approach to stop hypertension. Question number 53, where they are asking about the monitoring, because the day-to-day follow-up of activities during their implementation is nothing but the monitoring. Question number 54, I'll skip it for time being. Question number 55, it is very easy. The main target, the main thing should be the goal, followed by objectives, and we achieve those objectives by having some targets. So C followed by A followed by B. It is option 3. Question number 56, it is very easy question, because if you read the options, there is one term they have used, it is evaluation. So evaluation is something which comes at the end of the program. So the last option should be A. So there is only one option that has A as the last option, that is option 3. So C, D, B and A. So this is how you can save time also. Now coming to question number 57, I will skip this question for time being, and also 58 I will skip for time being. Question number 59, I'll show my material for this. Okay, so this is the table. So until 20 weeks, we need advice of 2 doctors. Okay, so basically they have said only we need only advice of 1 doctor. So option A is false. So the correct answer should be beyond 24 weeks of gestation, opinion of a medical board is required. Okay, because after 24 weeks, according to MTP Act 2021, approval of the medical board, and only if there is a substantial fetal abnormality. Okay, so the correct option should be option C and option D. Question number 61, which is very direct and easy. Accident come under disease, and loss of food will come under impairment. Cannot walk will be the disability, and unemployment come under the handicap. Now coming to next question, question number 62. I will skip this for time being. And next question is question number 63, which is also a very direct question related to emergency contraception. So I will show my SMCH notes, where I have mentioned the names of the drugs under the post-coital contraception, but I didn't mention the dosage. So please add the dosage under this section for upcoming UGC exam preparation. So the drugs are mifepristone and levonorgestrel and ethinyl estradiol, right? So the names are correct, but if you do not know the dose, you cannot answer this question. So please identify the correct option and add the dose under the drug names. Now coming to question number 64, I will skip it for time being. And question number 65 also I will skip it for time being. And 66 as well. And 67 is also okay. I can skip this for time being. And now coming to question number 68, which is very direct question. So here you need to identify the easy option. For me, it is cholera. So cholera is because of due to presence of an infective agent in water, right? So option B should be 1. So check the option which is B1, that is option 3. So the correct option is option 3. So you don't need to check the other options also. Now coming to question number 69, this is a very static question. If you know the dates, you can answer this. So okay, I will skip this for time being. Now coming to question number 70, which is very direct. I think I have mentioned in my material also. Attributable risk is nothing but the difference between the incidence among exposed minus incidence among non-exposed. So the correct option is option 1. Now coming to question number 71, I will skip it for time being. And coming to question number 72, it is also a very direct question. Let me show it from my SMCH notes. So now they are asking about the protein content from low to highest per 100 grams of raw food. So I have given a very direct table for this. If you can see the protein content from high to low, soybean has the highest protein content. So even if you remember the extreme, you can answer this question. So soybean should come at the end of the options, right? So it should be C. So there is only one option where you can see soybean at the end of the options. So the correct option is option 4. Now coming to question number 73, which is also a very direct question from demography. So I will show it from my SMCH notes. Okay. So if you can see, it comes under the measures of fertility. So just check the question what they are asking. They are saying the denominator should be reproductive age group in a given year. So what does it mean? So under denominator it should be number of women of age group 15 to 49, because that is the reproductive age period. So the correct answer is GFR, that is nothing but the gross fertility rate. Okay. Now coming to question number 74, it is also a very direct question. Chemoprophylaxis of malaria comes under the primary prevention. Now coming to question number 75, it is also very easy because we all know that H1N1 caused the disease pandemic A influenza, right? So option C should be 1. So there is only one option which where you can see C and 1 together. So the correct answer is option 3. Now coming to question number 74, which is also very direct question and very easy. See, check the options for A and C, okay? Because the first option, that is biological anthropology, it should include skulls and skeleton, right? So that is something related to biology. And similarly, cultural anthropology should include the cultural life of people. So option A should be 4 and option C should be 2. So check the option which has A4 and C2. It is option 2. So very simple, right? Now coming to question number 77, planning in its broadest sense include 3 steps. Which of the following is not one of those steps? So planning includes evaluation, plan formulation and execution, but hypothesis testing is something not at the correct place. So the correct answer is option 2. Question number 78, I can skip it for time being. Question number 79, okay, this is also very easy question because always remember the edges should be, they should be elevated. They should not be lowered, okay? And also the first two options, that is addition of chlorine is a method of purification, okay? You can read it from my SMCH notes. And second option, subjecting the tank water to some sand filtration. So filtration is also one of the method of purification of water. So option C and D are wrong because they're telling they should be depressed or lowered, which is false. So the correct options are option A and option B. Now coming to question number 80, which is also very direct question. I will show my SMCH notes now. Okay, you can see it very clearly, right? Because they are asking in the question, they have mentioned it that nominal and ordinal data. So when they use the term nominal and ordinal, it should be bar chart or a pie chart. So what are the correct options for this? It should be bar chart. It is option number 3. Question number 81, which is also very direct question. The water should be free from color and odor, free from harmful chemical substances. These two options are correct. But when you look at the third option, it should be free from all minerals and electrolytes, which is very false. And option D, it should be free from temperature variations. No. So only the correct options are A and B. And now coming to question number 82, which is also a very direct question related to steps of outbreak investigation. Okay. So I'll show my SMCH notes directly. Okay, these are the steps of outbreak investigation. First is verify the diagnosis. Next is verify the existence of an epidemic. Third is describe the epidemic with respect to time, place, and person. And the last step is formulate and test hypothesis. So it is very clear, right? So this is also a very direct question. Now coming to question number 83. So it is related to injectable contraceptives. Okay. So let me go back to my notes. So under injectable contraceptives, again I have mentioned the names of the drugs, but I didn't mention the dosages. So from now, if you are preparing for upcoming December exam, please add the values also. Okay, please add the dosage under these names. If you can check the drug names, it is MPA, DMPA, and also combined injectable contraceptives like cyclophem and cycloprovera. Now coming to question number 84, I will skip this question for time being, and also question number 85, I will skip this. And now coming to question number 86, which is very direct question. Which among the following are examples of social component of environment? So options given are customs, culture, housing and rodents. So option D is something out of place, right? So the wrong option is option D. Now coming to question number 87, which is a very direct question related to National Health Policy 2017. So I have already made a video on this. You can check it out in my playlist. Now let's check this in my SMCH notes. Okay, these are the targets under the health system performance. Okay, so basically we need to find out one option with which we can answer this question. That is option C, reduction in prevalence of stunting of under 5 children. So let's check the target for that. It is 40%, reduction of 40% in prevalence of under 5 children stunting by 2025. So if you know this, you can answer this question very directly without checking the other option. So there is only one option where you can see C as 2. So that is nothing but option 2. Now coming to question number 88, which is a very direct question. We need to find the steps in process of behavior change from first to start. So the first step is always informed, followed by concerned, and third is motivated to change, and the last option is the adoption of new behavior. So if you can see, there is only one option that is starting with informed. So it is option 2. Now coming to question number 89, which is also a very direct question. I have already dealt with this question in my previous videos. So let me go back to my notes and show you. Okay, these are the examples of qualitative and quantitative data. So where you can see, which example come under which category. Okay, so let me solve this question directly. So history of fever as yes or no. So it is basically a dichotomous variable. Okay, so option A should be 3, A3, and total number of previous pregnancy. It can be only 1, 2, 3. It can't be 1.1, 1.2. So it is discrete. So option B should be 1. And coming to option C, that is temperature measurement in degree Celsius centigrade. Okay, so that is interval. So option C is 4. And coming to option D, that is satisfaction level with hospital services on 5-point Likert scale. So basically it's order, right? So option D is 2. So the correct option is option 3, A3, D1, C4, and D2. Now coming to question number 90, this I will skip for time being. Coming to question number 91, which is also very direct question, and I can directly go to my notes to show this. So it is related to demography, right? Okay, so this is the demographic cycle, and these are the stages of demographic cycle. Okay, starting from high stationary, early expanding, late expanding, low stationary, and last is the declining. So very direct question, you can directly answer this. Now coming to question number 92, this is also very direct question. Let me go back to my notes again. So these are the goals where you can read and just remember these goals for answering those type of questions. And also, I've given a picture for this. And if you didn't watch my video of MDGs and SDGs, please go and watch it. It's in my playlist. And now coming to question number 93, that is emporiatrics. It is very direct question. It is related to health of travelers. Now coming to question number 94, it is also very direct question. So you can solve it because it's a repeated question as well. So please go through it. It's a very simple question. And now coming to question number 95, I will skip this for time being. Coming to question number 96, this is also a very easy question, okay? Because it's similar to goals, objectives, and targets, okay? Policy is something which is at the higher level, followed by programs, procedure, and schedule. So based on that, you can easily answer this question. Now coming to question number 97 related to vaccines. Okay, let me go back to my notes again. So we need to find out that one option with which we can answer this question, right? So that can be, I think it's rotavirus because option B has different options for each given option, right? So let's check the rotavirus here. So it's given orally. So what should be the option? B should be 3. So there is only one option that has B as 3. So it is option 2. Done. That's it. You don't need to check for the other vaccines also. Now coming to question number 98, which is also very easy because they're asking you to see the common features seen in a community. So there should be some common sentiments and that should be concrete, right? So the correct answer is option B and option C. Now coming to question number 99, which is very easy and interesting also because they're talking about rabies and they're asking you to tell the appropriate sequence. So any disease or in this case rabies, the last stage should be death and the starting point should be bite of a dog or any animal. So these are clear, right? Just before death, the sequence should be paralysis and coma. Before paralysis and coma, it should be aerophobia and hydrophobia because it should happen after the prodromal stage. So bite followed by prodromal stage, then aerophobia, hydrophobia, followed by paralysis and coma and death. So the correct option is option 2. Now coming to question number 100, which is also very direct question. They're asking you to expand the terms, right? PERT and CPM. PERT is nothing but program evaluation and review technique, whereas CPM is the critical path method. So the correct options are A and D. Question number 101, I'll skip for time being. And coming to question number 102, which of the following is not a feature of social change? So social change is a community change. Yes, it's true. The process of social change is not uniform. That is also true. Change may be natural or planned. That is also true. Forecasting of change is very easy. That is not true. So the correct answer is option 4. Question number 103, I'll skip for time being in my first attempt. And coming to question number 104, which is very direct question, I will go back to my notes. Okay, you can see the committees in chronology. Just try to remember this and you can answer these type of questions very easily. Now coming to question number 105, I'll skip this for time being. Question number 106 also I'll skip for time being in first attempt. Question number 107 also. And coming to question number 108, which of the following deals with population as a unit of study? Very easy question. It is ecological study. And 109, as I already said, years and dates. If you can remember this, you can directly answer this question. Coming to question number 110, which of the following are types of non-random sampling? This is very easy because quota sampling and purposive sampling are something done as per our convenience or our purpose, right? So these two come under non-random sampling. So correct answer is option C and option D. Question number 111, I will skip for time being. Now coming to question number 112, which is very easy. They have given a normal distribution of data which is having a mean of 150 and standard deviation of 15. So which of the following best represent the two values between which approximately 68% of the data will fall? So this is basically a conceptual question. I will go back to my notes for this. Okay, if you can see the normal distribution, 99% of the values will fall between 3 standard deviations, whereas 95 will fall between 2 standard deviations and 68 will fall between 1 standard deviation. So in this question they are asking about only 68% of the data. So it should fall between only 1 standard deviation. So what is the SD in this question? It is 15. So it should be 150 minus 15 to 150 plus 15, that is 165. So the correct answer should be, I think, 135 and 165. Now coming to question number 113, which I can answer directly because I know it's indirect age standardization. But don't worry, I'm soon planning to post a video on standardization with some numerical examples. Okay, for time being, you can just wait for that video. Now coming to next question, that is improving quality in labor room. It is very easy question, that is Lakshya. And now coming to question number 115. Okay, this is also a very direct question. Okay, I'll go back to my material. Okay, so this is the table where you can see type 1 and type 2 errors. Type 1 error is nothing but the null hypothesis is actually true in reality, but you decide to reject the null hypothesis. Okay, and the opposite to this is the type 2 error. So I think this is very easy to answer this question. Now coming to question number 116, which is also very direct question. If you have watched my National Health Programs video, you can easily answer this question. So let me go back to my material once. Okay, this is a table, a scale of cash assistance for institutional delivery under that particular program. So basically there are two types, LPS and high PS, low performing states and high performing states. So what are they asking about in the question? It's around, I think it's about high performing state for mother. So what would be the answer? High performing state for mother, and in rural region that is around 700 rupees. I think it is very easy question if you have gone through my videos or material. Question number 117, I will skip for time being. Question number 118 also, and also 119. Now coming to question number 120, which is also a direct question about the folic acid supplementation. So which I covered under the National Nutritional Programs. Okay, let me show it in my material once. Okay, so this is under the weekly iron and folic acid supplementation. If you please go through it and you can easily answer these type of questions. Now coming to question number 121, which is also very easy question. I have already made a video on this under the international health agencies, right? So let me show it in my material once. I have given a special table for this. Okay, these are the WHO regional organizations with their headquarters. Okay, so I think very static question. You just need to remember these type of questions to answer in exam. Now coming to question number 122, which is very easy. We all know that Ayushman Bharat, it gives coverage for up to 5 lakh rupees. So it is option 3. Now coming to the question number 123, which is about the loss of probability, which I have covered under biostatistics. Let me show it in my material once. Okay, this is where you can find it under properties of probability. So basically it's a very easy question. So the probability of an event that cannot occur or impossible event is 0, whereas a certain event that must occur is 1. That is also true. Each probability can be a number between 0 to 1. That is also true. And sum of probability should not be never more than 1. So option 4 is wrong in this case. Question number 1 to 4 I'll skip for time being, and also question number 1 to 5. Question number 1 to 6 is very easy because management consists of 4 basic activities in theory. Which one of the following is not one of the basic activities? So management include planning, organizing, monitoring. But forecasting is something which does not belong to this management. So the correct answer is option 1. Now coming to question number 1 to 7, I will skip it for time being in first attempt. And now question number 1 to 8, which is which of the following tests are type of non-parametric test? I know that t-test and ANOVA test are parametric. So the correct option should be C and D. So the answer should be option 3. Question number 1 to 9, I will skip for time being in first attempt. Question number 130 is very easy because which of the following are quantitative methods? So it is cost benefit and input output analysis. So the answer should be option A and option B. Question number 131 I will skip for time being. Question number 132 which is also direct question I have covered in my videos also. So I will show it in my material once. So these are the committees in chronological order along with the details under each committee. You can just go through them for better understanding. So very easy question. You don't need to stress much. Now coming to question number 133, which is also very direct question and easy question. I have covered it in my material also in my YouTube videos as well. So let me show it once. Okay, so this is the table classification of foods by origin, composition, function and nutritive value. Question number 134, I'll skip it, and question number 135 as well, I'll skip for time being. Now coming to question number 136, which is very direct and easy. When two screening tests are applied in parallel, the effect is the net sensitivity increases, whereas the net specificity decreases. So the correct option is option A and option D. Question number 137, I will skip for time being. Question number 138, okay, this also I will skip for time being. Now coming to question number 139, which is very easy and direct question. Which of the following are examples of mass approach of health education? So mass approach in the sense it includes television and newspaper. So the correct answer should be option A and option B. Now coming to question number 140, which is also very easy. Which of the following is not a social issue in marriage? Very clear, right? Genetic matching is something which does not come under the social issue. So the correct answer should be option 4. Now coming to question number 141, basically it's a comprehension related to screening. So I have made a separate video on screening, how to solve screening test. Please watch it, it's in my playlist. So let me show the formulas for this in my material. So this is the screening table, right? 2 into 2 table, and I have explained everything in detail in my video, and you can also find it in my material of SMCH notes. Please go through it. You can easily answer these 5 questions. Very easy. You can get 5 out of 5 in screening if you have been through my videos in YouTube or through my material. Now coming to the next comprehension, that is related to demography, which is very easy because I already made a video on this, okay? How to calculate these rates in separate video. Please go and watch it. It's in my playlist. For time being, I will show the formulas from my SMCH notes. So let me show the formulas for demography. Okay, these come under demography measures, okay? So it include measures of mortality and also measures of reproduction. Please go through all the formulas because these questions look difficult, but once you learn these things, these are very easy and you can score 5 out of 5 in this section. Because if you can look at the options, they have given it in a manner where you can see the numerator, denominator and a multiplier, so that you don't even need to calculate these questions. You just need to know the formula for these questions. So please watch my video, or you can go through my material. If someone has purchased my material, please revise all these formulas so that you can easily get 10 out of 10 in this section. And now after first attempt, the total number of questions I got correct in paper 2 is more than 60. So please understand my approach, and I hope you all respect your own strengths and weakness and plan accordingly. So now I am left with more time. So I can go back to the leftover questions. I can spend some time on them. If I can be able to answer those questions, that's fine. Or else I'll put some option very blindly. But still I can score more than this, right? I can't score less than 60 or less than 28 in paper 1. So I think this is one technique I follow to save the time so that I don't end up, not solving the questions which I'm very good at. And regarding my SMCH notes, trust me, there are many questions which came directly from that. Please try to purchase it and you won't regret it. So thank you for watching this video.